counties that you have offices. You all have not heard of Guardian Insurance before. It was a company that was started in 1860. It's one of the strongest financial institutions in the country, consistently receiving the highest ratings from the various rating services. They specialize in medical insurance plans for employers with 50 to about 500 employees. And they currently administer almost 100,000 group medical plans across the country. Your employee benefits plan is made up of 4 separate benefits: life insurance, medical insurance, dental insurance, and long-term disability insurance. And what we're going to do this morning is we're going to review the benefits under all of those plans and answer any questions you may have about the benefits or about the administration of those benefits. This morning we have Sarah Turner here from the Guardian, who is your group service representative, who provided the material you have in front of you, the outline of coverage, and who is going to go through those benefits with you now. So Sarah?
Thank you. This benefit summary that you all have in front of you is just a summary. So if you need to get into more details, make sure you look in your, not your directories, in your handbooks. Everyone should have received their handbooks. I know they're a little overwhelming, but there's got a lot of good information in there, so you need to look over those when you get a chance. Now, as far as this network, or the different networks that we're all utilizing, the booklets that you all have received, the directories, as soon as these are printed, they're outdated. Doctors are going in and out of this network every day. So if your doctor is shown in here, there's an 800 number in the front that you want to call and make sure that they are still a member of the network. Also, if your doctor is not shown, you can call the 800 number and find out if they've been added. And if you'd like to get them added, they'll give you the information at that time. So that's something that you really need to keep in mind, because if you go to the doctor assuming they're in and they since have gone out of the network, then you're going to be covered as an out-of-network benefit and not what you had originally expected. Now, as far as the summary that's in front of you, there's a deductible for both in and out of network. That's a $250 deductible. The maximum is 3 per family, so it's $750. You have co-insurance. In network is 90% and out of network is 80%. The out-of-pocket for an individual is going to be $1,000, which is plus that $250 deductible, and for a family it's $2,500 plus the deductible. Now, your benefit year is a calendar year, so it's January 1 through December 31st. You have a 3-month carryover, meaning if you have met expenses the 3 months prior to that January 1, those expenses have gone towards your deductible and you haven't reached your deductible, it will carry over to the next year. So that's a nice benefit. As far as physician's office visits, there's a $10 copay in network. So whenever you go to your doctor's office, it's going to be $10. That's it. Out of network, it's subject to the deductible and that 80% co-insurance. Your lifetime maximum is unlimited, and this is a great benefit because a lot of plans have a maximum that is $1 million, and that $1 million, if you're in an accident and you get hurt or you have claims that are continually coming in, surprisingly, you can meet that $1 million maximum in a short amount of time, so this unlimited is extremely important, and it's a nice benefit that's been added. Your dependent eligibility is 20 or 26 for a full-time student. So that's another nice benefit you have. I want to back up for a moment. For the physician's office visits, the $10 copay does not go towards a deductible. It's totally separate. Okay, so that's something you might want to keep in mind. Your prescription drugs, there's a $5 charge for prescription drugs, and oral contraceptives are included. The $5 can also be used for, or is used for, generic or non-generic. It doesn't matter. If you do want to get a generic drug, you need to have your physician write dispense as written on that prescription. Otherwise, you will get the generic form.
I mean, if you want a non-generic drug.
What is that?
I think you said generic.
Okay, I'm sorry. If you want non-generic, yes. You need to have your physician write dispense as written. Otherwise, you will get the generic. And it's the same price, $5. Also, what's included is a mail order program. This mail order program allows you to get any maintenance drug, a 3-month supply for $3. So it's something if anyone has, on blood pressure medication or anything like that, as long as it's a maintenance drug, you can mail in your prescription that will only cost $3.
What do you mean by maintenance?
Anything that's continual, anything that you've got to have month after month after month after month.
Right.
It's not something, if you're sick and you're going to have a prescription that's going to last 2 months or something like that. It's got to be continual. As far as your hospital emergency services, it's 90% after the deductible in-network and 80% out-of-network. In this area, it's almost impossible to find a hospital that is not in the network. Every hospital around here is in the network. So you're pretty much going to have the in-network rates. If you do happen to find one, you're going to pay the 80% after the deductible. Now, what also applies here, and you'll see your x-rays and labs are 90% in-network and 80% out after the deductible. But then you're going to fall into your hospital and physician services, inpatient and outpatient. If you go to the hospital and you go to that emergency room, just because that hospital is in the network doesn't mean the physicians in that hospital are in-network physicians. So this plan's going to work for you, but you've got to work a little bit for it also. As far as emergency room visit, obviously you're going to the emergency room because it's something that is very urgent, it has to be taken care of, and you do not have the time to say, could you please find a doctor that's in-network? That's not going to happen. Therefore, Guardian understands this, and if it's an emergency room visit, the doctor's services are also going to be paid as in-network because you don't have the control at that time to make your decision. If it turns into an overnight stay and the next day you are going to have to see a doctor and labs, things like that, that's when you do have control over the situation and can ask for an in-network physician. Okay, so you're not going to be penalized for going into the emergency room and the doctor not being in the network. It's not in your control at that time. You have preventive care. It's a $10 copay for in-network. Out-of-network, that deductible is waived, and then the co-insurance kicks in, which is 80%. You have mammograms and pap smears are under here, which I wanted to point out for the women is sometimes if you go to have your annual physical, you may only be able to get half of the treatment done in the OB/GYN, the gynecologist's office. Maybe you need to go see an internist for the other half of your exam. You can do this, but you need to make sure that those 2 visits are as close together as possible. You can't spread them by 3 or 6 months because they will be considered 2 totally separate visits. Also, you need to make sure that your doctor, both doctors, write that the first part when you went to your OB/GYN was 1/2 of your annual physical, and the other doctor says this is the second half, so it's 1 complete annual physical. So you can do that. This is also a good way for the men to find a doctor who's in network. A lot of times you only go unless you're sick. At that point, you don't want to go flipping through the book trying to find a doctor that's in network. It's nice to be able to go and do the $10 preventive care and maybe find a doctor in the network that you like. For children under the age of 16, it's 2 visits per year for preventive care, and over the age of 16, it's 1 for adults. Now this is for Virginia, or actually no, I'm sorry, this is correct. For child health supervision, actually, it might change for the other areas. I'm going to have to look into that.
I think it says on your sheet that since it's written in Virginia, that all of the states are
You're
covered as their...
You're right, I'm sorry. So we'll continue. The benefits for the child health are 1 for the following intervals: 2 months, 4 months, 6 months, 9 months, 12, 15, 18, and 2 years. And that's 1 visit per year. Then from 2 until 16, you have a 2 for the children, and 16 and over, again, you have a 1 for the adults. All right. Now, this is where I had a little error in my typing. It should be mental health, not dental health, and substance abuse. And for the in-network, instead of the 80%, it should be 90% for your coinsurance. So the change is good. Inpatient, there's a 20-day maximum for children or for persons under the age of 19, and 25 under the age of 19. Covered at 90% in-network and 80% out of the network. Both are subject to the deductible. As far as outpatient, there are 20 visits per year. These are limited to the first 5. In-network is 90%, out-of-network it's 80%. And then 6 through 20, it's 50% both in and out of network. And again, it's subject to the deductible. The limited benefits, these are questions that have come up, so we've just added this into this benefit summary so you will know. The foot disorders, this does not apply to fractures and dislocations, and that's something that has come up a lot. It's for any sickness or deformity below the ankle, up to a maximum of 2,500. Spinal manipulations, it's a tough word. Chiropractors, we pay up to 30 visits. Home health care, covered up to 100 visits per benefit year. Treatment for infertility, lifetime maximum of $25,000, which probably doesn't sound like a lot, but it's a good benefit. Your pre-existing conditions, as long as you're on the prior carrier, come over to this carrier, there's going to be no change. As long as it's something that Guardian would normally pay, it will be paid. Now this pre-treatment that is shown at the bottom, you must call in advance if you're expected to have a hospital stay, at least 7 days in advance. If for some reason you've gone into the emergency room, they require that you call within 24 hours of that emergency room visit, stay. If you can't, if you're knocked out and cannot do it, Guardian's not going to penalize you for that. But normally what will happen is if you're going to have a hospital stay, or if it's an emergency room, on your ID cards, this is all written out in black and white, and every hospital out there knows about this, and they will call. Because if they don't, your benefits can be decreased, and they want to get paid, so they're going to call. But it's something you need to be aware of and make sure that it is done, or the benefits will be decreased. At the bottom, it will show your claims office. If you ever have a claim that comes in and you don't understand it, or you want to know how something is going to be paid, what does this code mean? Why is this amount showing? I don't think I'm supposed to pay anything for this. Call the claims office. They will have all your information on the screen in front of them. They can help you out. If they're incorrect, you can let them know. If it is correct and it's just confusing to read, the best thing to do is call them directly. Then if it does become a problem and there is something that we need to look into a little bit further, then definitely let us know. But normally it's something that can be handled up front with the claims office directly. Any questions regarding your medical?
Is that where it says PHCS or Alliance?
Yes.
I should just let Columbia know that theirs is HealthLink. Ewan, can you hear me?
Ewan?
Oh.
Here, so it takes us a while.
You should just let them know it's in HealthLink.
As far as the employees that are in the HealthLink network, I'm going to get a benefit summary out to you that will give you the correct claims office and number. So you need to disregard the claims address and number.
They
that's
have
on
the
the
address,
form.
the correct address on the form.
We're already submitting claims to the St. Louis office of HealthLink, and I've had claims paid personally, so I
Great.
know that the process works.
Okay, I just didn't want anyone to think that the number on this form was the claims office for your area. I will get a new summary out to you.
I have a question. This is Paul.
Okay.
I've been charged twice on my dental for my deductible. Once under John Alden and once under Guardian. Who do I call?
Did you Did you submit any evidence of having paid your deductible under John Alden 2 Guardian?
In St. Louis?
Yes.
Okay, thank you.
You're welcome.
So that, people should just know that in general, though, that if they
Exactly.
have paid their deductible to John Alden already, that it will carry over to Guardian. And all that you,
You just need to show, what you need is your last explanation of benefits, EOB, from John Alden, and submit that to Guardian.
and if you didn't keep it, you can we can call John Alden and ask them for a
Yep.
copy of that.
Exactly.
We have a question here in Chicago from Dave.
Okay?
Yeah, what happens, let's say if you're out of state, and you're in, a car accident or something, you have pretty no choice which hospital they're gonna take you to. So how, or you did know what hospital, say out in Denver or someplace, how would you know this hospital's covered under, the 90 or the 80?
It's going to be considered out of network. It's something that you still have good benefit, you still have the deductible and coinsurance and a low maximum, but unfortunately, if you're out of state and you have to have some medical treatment, then it is going to be considered out of network.
Okay.
Any other questions? Yes. We had a question here as far as foreign travel, and foreign travel is covered if you're out of the country and you get sick or anything like that, it will be covered. They need the exchange rate of the day that you had this treatment, but it will be covered.
How much will be covered?
It all depends on your, percentage. It's going to be the 80% because it will be out of network and the $250 deductible and
So it's covered just as if it were an office visit in the States, out of network.
It's going to be covered out of network. So it'll be subject to deductible coinsurance.
It's very important to, on these types of plans, to understand that any time that you're going to receive medical services, you have the choice of choosing to be treated in the network or out of the network. You can receive all your services theoretically in network, or all your services theoretically outside of the network, or you can mix and match. Okay? But there are three very important reasons why you should try to receive all your services in network. Number one is that in the network, there are no claim forms for you to have to handle. Number two, as shown on the handouts you have, the benefits you receive are higher in the network. And number three, which is probably the most important, when you go to a doctor or hospital that's in the network, they are discounting the cost of their services anywhere from 20 to 30%. As opposed to when you go outside the network, where they're receiving no discounts at all from those providers. So anytime you have a chance to receive your services in the network, it's going to be to your benefit to do so. It's just going to mean a lot less money out of your pocket. Any other questions on the medical benefits?
Yeah, how are the doctors selected to be, participate in this network?
We have three different networks, but all the networks work essentially the same. The people that are setting up the networks will go into a geographic area where they want to establish the networks. They will solicit doctors to be part of the network. They have a screening process that they use. The doctors have to meet to be a member of the network. Once the network is set up, you have doctors leaving the network, either because there's some reason that they want to leave, they want to go on maybe to another network. You have doctors that are terminated by the network because they're not doing the job that was expected of them. And each doctor that's in practice normally belongs to 3 or 4 different networks at the same time. So this is the trend in the medical industry for doctors to belong to these networks, or they're really not going to be in business any longer. And that's what is generating these discounts of 20 to 30% off of their normal fees to people that belong to the networks.
You might,
If your doctor is not in the network, your present doctor, is there any way, you know,
Yes,
get into,
you can ask your doctor to participate in the network. And there's 800 numbers in the directories that you can give to the doctor, that he can call the network and ask for the paperwork to apply for membership in the network. Now, as an independent businessman, it's going to be his choice whether he wants to do it or not. Any other questions?
Yeah, I ran across Georgetown University Hospital. They had contracted with Alliance to take what the provider, what the Alliance considered was a reasonable fare. Is there a list of any of those kind of hospitals within the network?
Yes.
To see which ones have contracted, so, that saves people a lot of money.
Yes, in the front of your medical directories, there's a list of the hospitals in your geographic area that are part of the network.
Some of them don't, I ran across one hospital that I was in, that, basically the 10%, you had to pay beyond, but Georgetown, the bill was say $190, the approved rate that Alliance would pay was $165, so Georgetown accepted $165 instead of $190.
That's correct. That's the discount, the 20 or 30% discount we're talking about.
So the hospitals enlisted in here and all do that now.
Yes, that's correct. Now, part of the agreement is that this discount, this 20 or 30% discount, that has all been negotiated ahead of time with the hospitals and the doctors that are part of the network.
That's one reason why some hospitals, doctors might not want to go into the network, because they can only charge a reduced fee. They can't charge the $190, they can only charge the $160. You're not responsible for that $30 difference. And some doctors might not want to do that. Their business is, up and running, they don't need to take a lower fee. Their practice is full, so that's why they would need to accept Guardian or Alliance's figures. And Alliance would also need to accept them after doing the screening and make sure that they're, reputable doctor, et cetera. Also, something as far as the out-of-network side of this, there's something called reasonable and customary. Guardian pays at the highest percent, which is a 90% of the reasonable and customary, meaning they will pay what 9 out of 10 doctors in that area would charge for a service. This only applies on the out-of-network side. So a lot of times you're not going to run into this because Guardian does pay so high on the scale. But maybe your doctor would charge $120, where the 9 other doctors out there charge $100. Guardian's going to pay with it. 9 other doctors would charge the $100. That $20 difference would be your responsibility. Sometimes the doctor will, suck it up. They won't make you pay it. Other times they will make you pay that $20 difference. So it's something you want to be aware of.
Does that not apply to dentists?
That also applies to your dentist, out of network. It does not apply in network.
If
Yes.
you do deny payment for a claim, do you have any reconsideration process?
Yes. The question was, if we deny a claim, is there a reconsideration process? And yes, you are welcome to come back and fight the claim and give us some more information, and it could be overturned. So if you get denied, you don't have to take it. You can try to get your money, or maybe we might not. I can't guarantee that it's going to be overturned, but if you feel that it should have been paid, I'm sure.
I have a question in Columbia.
Mm-hmm.
On the $3 maintenance drug, is that only for mail-in?
Yes,
Okay.
yes.
And what type of physicals are you covering for adults once a year?
It's a preventive care, so it would be just an annual physical. You get your blood work and that type of thing done. It goes over it a little more in your booklets. It gets into a little more detail. But what would happen is when you go to your doctor, there's so many different codes out there that these doctors can use, and one of them is an annual physical. And as long as that one visit is coded as an annual physical and everything that is done under that would be paid for the $10 copay in network, or the 80/20 out of network with the deductible wage. So it's something that when you go to your doctor, you need to let them know that you're coming in for your annual physical. Is that good enough? No news for you. Any other questions regarding the medical?
Are these limited benefits, like if you go to a chiropractor, for example, are they in network, out of network, or is that just you go into a chiropractor doesn't make?
No, we have chiropractors that are in network.
And would that still be a $10 copay kind of thing?
Yeah.
Oh, wow.
Any doctor's visit, so it'll be $10. One other thing I want to point out about the doctor's visits, now that we're talking about it, is if you go to a doctor's office and you pay for the $10 copay, let's say they take an x-ray and they send it out to a lab. The lab might not be in network, so it would be subject to the deductible and co-insurance. I just want you to be aware of this, because if you get hit with this bill, and well, this was at my doctor's office, it was $10, but he sent it out to someone. It does happen. So it's something you need to be aware of if you have x-rays taken. Sometimes what the doctors will do, will put the entire fee under their bill, so it will be paid at $10, and they will go directly to the lab themselves and get the payment worked out. But as far as they can send it out, and you can be billed separately for that x-ray. If it's sent out to a lab that's in network, you're fine, but it's something you might want to be aware of. Filling you with information.
This happens a lot. I get a lot of questions from employees saying, I went to my doctor, I had, a throat culture done, why am I paying extra for it? So this is something you might want to talk to your doctor about when you're having tests done, saying, I'm part of the PPO, can you make sure this is taken care of under my PPO plan? Make sure you have an open line of communication with your doctor about that.
Exactly.
'Cause
It's
it
a good
happens
plan,
a
but
lot.
You do have to work a little bit. You've got to be aware of what's going on and how it works, and unfortunately, it's not cut and dry, $10. So it should be, but exactly, if you're going to have some lab work or x-rays, then you do need to be aware of what can happen and where that lab is being sent, that test is being sent. Okay, are we ready to move on? The next page shows your life insurance. One times your salary to a maximum of $100,000. This also includes accidental death and dismemberment, which is gone over in your book, but it's double indemnity, meaning that if you died in an accident or if there was some type of dismemberment involved, then you would get twice the amount. Now your dental works.
Wait, before you go forward, I just wanted to mention the additional life insurance that we had talked about this morning. If people are interested in getting additional life insurance, I'm going to send around a memo next week. We have to have 10 employees that are interested in having this additional life insurance. It's a cost per $1,000. So I'll send around a memo next week to let you know about that.
Would come right out of your paycheck.
Which will be, right, we can take the fee right out of your paycheck.
Did you say what the price is?
You know what, Nancy, I don't know offhand. I will
That's what
include
you
that.
said. I couldn't hear. Is that what you said you'll find out next week?
There's a chart that Tammy will provide showing the cost per thousand.
Okay.
It depends on your age and your sex.
Okay.
Your class is sufficient.
Yes, our life insurance does include your commissions. It's not just your base salary. What we do for that, it's an average over the last 2 years of your commissions.
Commissions and or bonuses, depending on time.
Commissions, not bonuses.
We ready for dental? Your dental works in the same way as your medical. It's got a separate deductible, $50 deductible, 3 per family. So if there are 2 people in your family, you're each only going to have to need $100. One's $50 and the other's $50. If there are 5 people in your family, the most you will have to meet is 3 deductibles, $150. The next section talks about proposed treatment. If you're expecting to have dental treatments going to cost $200 or more, Guardian does not require but suggests that you get this pre-treatment review. And what it is your dentist will complete a dummy claim form and show what the treatment that he's going to do on you, what he's proposed. And we'll send that into Guardian. Guardian will come back and tell you what we will pay for that procedure. This benefits you because you'll know what will come out of your pocket. And also, if it happens to be, let's say, December, and you're having some treatment that's going to take a few weeks to have done, and it's going to be costly, you're going to meet that maximum. There's a $1,000 maximum, annual maximum on this plan. So if you're going to meet that maximum, maybe you could get some of it done in December and meet your maximum, and then some in January and meet your maximum. So it's something you can work with, and getting this pre-treatment review is important for you because you'll know exactly how much you're going to have to pay out of your pocket. So again, you have that $1,000, and that's an annual maximum that Guardian will pay. Your preventive care is covered at 100% both in and out of network, and there's no deductible. You can have one cleaning separated by 6 months. So you have one cleaning every 6 months. You cannot have cleaning 5 months and 15 days. It will not be considered preventive care. You need to make sure it is separated by 6 months. And I've even had dentists tell employees who have called, no, it's 5 months and 20 days. We need to wait another 10 days before you come in. It's very important because otherwise it won't be covered at that 100%. For in-network, for your basic services, meaning the fillings, that type of thing, your deductible will then apply, the $50 deductible. In-network, it's covered at 100%. Out-of-network, it's at 80% after the deductible.
What is considered emergency treatment?
Maybe an emergency root canal, is that something that people get done?
Or maybe if you chip a tooth.
Something like that.
Okay, well, this is the experience that I've already gone through with Guardian. I had to go to it's a special dentist, is another way to describe it. And what they do is they do root canals backwards, okay? You have to go through your gums, stuff like that. And I called Guardian at least a dozen times, no kidding. And I got a different answer every single time. So the dentist was pretty fed up with it, and I had to get two teeth done. And basically, it was an emergency. I was all infected up in here, and if not, I have all kinds of problems, okay? Anyway, so Guardian, he put one under, through Guardian, right? But the other one he made me pay, okay? So I have $775 that, is sitting on my credit card, and I want to know, and I submitted it to Guardian, and I want to know, are you going to pay me back the $775? What happens if your contract with him only pays $500?
Okay, is he an in-network doctor?
Yes, I went through Guardian, and he is.
If our contract with him only pays $500, that's all we're going to pay. You are not responsible for that difference. That's what he has agreed to charge for that procedure.
Right, so what is that? So he's going to give me back my
Yes,
$275?
you would have to get reimbursed from him.
What happens if he doesn't?
He has to reimburse you.
I would,
Well,
Yeah.
Well, no, I'm serious, and I mean, no, he doesn't have to reimburse me.
That
yeah, but that's a
225.
separate kind of an individual thing.
Right.
Maybe we don't want
Right,
to
that-
take up
that would-
everybody's.
Well, it's
I
not
mean,
that, it's
the
a serious
end result
issue.
is if he doesn't want to give you back your money, your only recourse is to sue him,
Right.
okay? Now, Guardian might throw him out of the network also. There's
But
no
I
way
need to let
Guardian
you all know
forces
that.
him to do that. Oh, yes.
If he's not paying you, definitely let us know. Definitely. But that difference, again, if they're in network, they cannot charge you. You'll get claims, and your claims will say discounted amount. Make sure that's the in-network dentist or doctor where it says this. But if it says a discounted amount, that's the difference that they would have normally charged, and that's not your responsibility. So in the $200, it would show as a discount amount, and that's not your responsibility. And it will also show a code saying this amount not responsible by the district. So again, it's 100% in-network for your basic services and 80% out of the network, and that's after the deductible. As far as your major services, bridge work, things like that, it's 60% in-network after the $50 deductible and 50% out of the network after the deductible.
But by posts in here, that means the new technology, putting a post in and putting a time to.
I cannot tell you for sure. That's what I would assume, but that's something, if you're going to have that done, call claims office.
Who do we call? Is there a spec?
Yep, there's that 800 number right at the bottom.
All right.
You have to remember that anytime we're in a discussion group like this, talking about claims and how the plan works, we have to do it in a generic
Yeah.
type of scenario, because each claim has its own individual history and circumstances that it's impossible to know without having.
I'm just asking that because that's a change in policy for dental. Had considered that cosmetic post before cosmetic, and so a lot of people might be interested in that because it's better than having bridge work. So,
Well, again, that would be an inexpensive treatment, I would assume, and that's when you go have your pre-treatment review and find out how they're going to pay it.
I'm pretty sure that that procedure is covered nowadays.
Again, as was said before, if you remain in network, you're going to pay a lower percentage, and Guardian's going to pay a lower percentage, or a lower percentage of that total amount, where a dentist may normally charge $100, they're going to charge $75. The Guardian's going to pay a percentage of $75, and they're going to reach that out of pocket, that maximum, that $1,000, that much slower. So it does benefit you to stay in the network if you can. Now, as far as your orthodontia, it's 50%. The deductible does not apply, and this is both in and out of network. There is a lifetime maximum of $1,000. It's not an annual maximum.
Is that per person?
Per person, and this applies to children under the age, or adults under the age of 19.
So over the age of 19, you don't cover
Over the age of
orthodontia?
19, there's no coverage for the orthodontia.
Okay.
For children, dependents, or?
Well, it's in employees under the age of 19, or dependents under the age of 19, actually, yeah.
Orthodontists.
The,
Or your,
Right, anybody over the age of 20, they don't cover for orthodontia.
correct,
exactly.
for your dependent.
There's a late entrant penalty, and I've just jotted this down. This is for any dependents that are added, or if you're currently not on the dental plan and you decide to come on later down the road, there's a late entrant penalty. As far as your basic services, your fillings, that type of thing, there's a 6-month wait. The major services, there's a 12-month wait, and for orthodontia, there's a 2-year wait. Your preventive cleanings you can get day 1.
Well, what was that about orthodontia? There's a 2-year wait?
If you're a late entrant. Unfortunately, I don't have that on your benefit summary, but if it's a late entrant, then yes, there's a 2-year wait for orthodontia.
No one here is a late entrant. Everyone
It would
here
only
is,
be for dependents or someone that currently isn't on the plan and wants to come on later. And the only reason is because you're paying your premium up front, and someone now wants to have their child, get braces for their child, so now they're going to add them. Well, it's not fair to the rest of you that have been paying for your dependents up front. So that's why we have these penalties. But the cleanings are still available.
Yeah, but newborns are considered, there's no waiting period for a newborn.
late entrant means if you're an employee and you come on board and you wait 6 months to come on with Guardian, that would be what is a late entrant, not if you're a brand-new baby, and
Right.
or if you're a brand-new employee with Blackburn and you come on with
Right.
our health insurance immediately. A late
Okay.
entrant is only if you choose to come on with Guardian after you've been employed with us for more than 2 months.
After it's been made available to you.
Okay, what happens if you're on it and you want to put your dependents on it later,
Then they're considered late entrant.
but a newborn isn't?
Right. Exactly. The last item is your, I'm sorry, any questions regarding the dental? The last item is your long-term disability, and I'm not going to go into great detail because it's long and it can be confusing, and it's all in your benefit booklets. And hopefully no one will need this, but if you do, it's a great benefit and it is available to you. There's a monthly benefit of 60% of your of your monthly salary to a maximum of $5,000. There's a waiting period of 30 days for sickness and 30 days for accident, which is great. It's very low, and I rarely see one with such a short waiting period, so this is a nice benefit. The maximum benefit period is to age 65, subject to the Age Discrimination and Employment Act. And all of this is broken down in your benefit booklets, and it can get confusing, therefore I'm not going to go into any great detail about it, but it is there, and if you have questions, there's the 800 number as well for your long-term disability.
By the way, when we say 60% of salary, declining salaries including bonuses.
Including commissions, not
Including
bonuses.
commissions, Not counting bonuses, including commissions, the average.
Actually, don't take any pictures in the camera. I'm gonna do something.
There's Kelly. Kelly!
Kelly's back. Or Kelly's back. He's on the phone.
There's her area. I gotta go around front so you can see the front. Hold on.
About this conversion,
Here's our front door. Well,
if you can do that. So
this is the front door. You can see me in the reflection. There's the elevators. And then we come in.
we set up a
And Kelly, oh, there's Kelly.
for the environmental day till we have an agreement on that.
You can see our pretty sign.
With this,
Kelly hiding herself.
so take care of that. And Dick's got the crime.
You can see our two fax machines. The one on the left is for incoming, the one on the right is for outgoing.
You work at a restaurant, right?
So then you walk down there and to the right, and you can see our workstations over there. Here's our conference room. There's Eric on the phone. He's talking to Gary. You can see the outside over there. There's our conference room.
Okay. Anything
Kelly's
special
still
to
hiding
follow
herself.
for it? Okay. You're a little hiding place.
Kelly! Kelly!
Steven,
Kelly!
Steven, please dial extension 108.
There's Tom Carey.
Is he reading
Hi, Tom.
papers?
Oh, it's nice to see you.
Say hi to Tehran and Terry and John Hobson, if he chooses to watch this. There's Tom. That's Tom's
So, what's this
workstation.
all about, anyway?
We're sending him a tape.
That's lovely.
You need to put holes in the eye.
Oh, let's see John. There's John Brunkart.
You seen Eric around anywhere?
Hey, Jamie?
Eric is on the phone in the reception area.
Okay, thanks.
John, you're really funny.
Hey, Jamie?
Hey, Tom. Yeah?
I'd like to send a special hello to Tom Davidson, who you failed to mention.
Oh, I'm sorry, Tom. But Tom's been here. Well, John's been here too.
Silly bastard.
Let's
We
watch
should say
Tom.
hello.
Tammy, go away.
Oh, here comes Lon. Lon. There goes Lon. Lon, don't go away yet.
What?
Because look in the conference room.
I hate those things.
There's my office. You can see my newest Thomas McKnight print in there. Well, just barely. There it is.
I want to go this way.
You want to go this way? Okay. Nothing to see here, folks. Move along. No one's avoiding the camera here. Nope. No one. Hey, get
There
that
goes
thing out
Ann
of
Cole.
You gone in? All right. You're welcome.
All room. There's UDSLA. That's where we send your stuff from every Friday. These are our mailboxes. Aren't they pretty? There's our snack machine, and it looks like it's empty because it's Friday. There's our bulletin boards. See, if you guys send us some pictures, we'll put some pictures of you right up there. There's just the copy machine. There's the soda machine. There's our forms file. I hope I'm not making you sick. See, there's a little hallway. Right next to it is our kitchen. I'll show you that. Hold on. Here's our coffee machine. I can't get it in any fuller view.
Our coffee machine.
Here's Diane. Hi, Diane. And Diane is making what, lunch?
A bagel.
A bagel for lunch. Is this from Wednesday lunch the other morning?
Yeah, I stole some.
Cool. There's our little suggestion box. It's always empty and it has dust on it. There's our cabinets that are empty now because I threw everything away. Here's our refrigerator. And there's our trash cans. It's very exciting. Here's Ken Anderson, working hard. You can see all around his workstation.
Did you get Guy yet?
No, not yet.
If you'd like to, you can stand on my chair and get him.
No, I can't stand on your chair. Oh, there's Guy. Guy. Say hello.
Hi. I'm trying to see if Kim wants to play some dice this afternoon.
Guy, now tell me a little bit about yourself here.
About myself?
Yes.
Not much to tell.
Come on, you're Guy Hayes.
I'm fat.
You're not fat.
Yes, he is.
Yes, I am.
There's John again.
Hey, you got the
Guy, what, you have
clap
2
thing
kids, right?
2 kids, yes.
Nathan was
no
here
wife.
helping us.
Don't want a wife anymore.
I thought you were wifeless.
Wifeless, yes.
Lifeless.
You're wifeless, and you, did you finish your school yet?
What's
still,
cool?
Are you still working on your doctorate?
Yes, I'm still working on it. I'll probably be working on it until I die.
Okay, good. Okay, now what are you playing with there? You playing with some dice?
Yeah, Ken and I shoot
Interrupting
crafts
the
this
afternoon
afternoon.
craft
Nothing's
game,
really
interrupting
happened in
sales
the office, so.
Oh, okay, so let's say hi to Ken now. Okay, Ken, now tell us a little bit about yourself.
Not much to say.
You have a son, right?
Yeah, I have a son.
He's what, 20 years old?
19, gonna be 20.
And what are you doing there?
Going through papers.
Wow, there's a lot of papers
Determining
there.
who to call next.
Great.
So,
Oh, there goes Lon again. She's hiding.
yeah, get Lon in this.
Okay, now, unfortunately, Brian is not here today. Oh, now what is... Guy is running around. This is the nightmare workstation here. Brian piles all of his crap here. Now I'm allowed to take Chris for 1 minute.
No, it was
There's
only
Chris.
about 5 seconds.
There's the 5 seconds. Chris is
Only
on the
about
phone.
5
We
seconds.
won't bother him.
I'm working
He's
diligently.
working very hard.
And I'm doing everything I'm supposed to be doing.
Okay.
Eric, as you notice, I'm on the phone.
He's making outbound call.
This is an outbound call. It's
Boy,
originated as an
sounds
outbound
like
call.
a really understanding client.
And from what I understand,
There we go.
it's a Visa card number. So
When you had that shoulder down,
this is my view.
all that, you
This
look
is
like
Chris's
Big
view,
Cat.
and it gets
All types
really
of
hot.
wildlife outside this window.
It gets really hot out sometimes.
You look like Big Cat. When you let that left shoulder down, you can't see all of you.
And here's Chris's very nice workstation. Very neat.
It's called a cube.
It's not called a cube, it's called a workstation.
Yeah, workstation. And we are politically correct, aren't we?
Yes, okay. Goodbye, Chris. I've
Though
extended
any
my
from
time
Memphis,
period.
I'd like an Elvis poster or something.
Okay, this is Brian's workstation, and as you can see, Brian is not here. It's Friday, he's gone to the beach. We'll move forward now. Okay, here's the hallway. There's Chris. Hi, Chris.
Who am I saying hi to?
This is to Tehran and Tom and
Tom?
Terry and
Tom, we know
John.
each other, Tom. Tom, this is what we use to bring the copiers into the office. So, I mean, if you borrowed, if Pitney Bowes ever called again.
You what?
You get your commission back.
Oh, really?
There's Val.
when Val wants.
That's Dave Huffman's office right there, but he's gone for the day.
Stop. What are you doing?
That's Lon in her office.
You get bigger, Eric.
And that's Eric and Val hiding. And you guys know what Eric looks like. And this is his very nice office. A very nice view that gets very hot sometimes because Dick will not allow us to roll down the Venetian blinds.
It's my messy office.
Well, he'll get it clean, don't worry. There is the production area behind that little wall there. We'll go over there in a second. There's Malia walking down the hall. There's Steve. Hey, Steve.
Eric.
Hi, Malia.
Hi, Tommy.
Say hi to Tehran and Terry and Tehran and Terry
Hi,
and
Tehran,
John and
Terry,
Tom.
John and Tom.
There we go. And now we're gonna look in Dick's office. There's his little conference table. Dick's not here today either. He's in Canada somewhere. He has a very nice office. Here are the pictures of his kids, his 3 little boys. They're cute. I think that was a few years ago. There's a picture of his wife. The beach. Other cute little pictures. Okay, you're not going to be able to see those. Sorry. Okay, let's go move on now. Her workstation. Are you? A lot of orders today? There's a printer. I think that's a color printer. And this is Mike Price's workstation. Mike isn't here at the moment. I think he just stepped out to grab some lunch. And this is the wall that separates. You know, that's Eric's office over there and Dick's office over there. Those are production faxes. Their printer. There's Steve. Hey Steve, you working hard?
Yeah, very hard. Sorry, I can't talk.
No, no problem. We'll just watch you work. There's Steve's workstation. Very neat and organized as usual. And John Burkhardt is in that office over there. He just moved, so we're not allowed to see that place yet because it's not finished. That door is where we keep our network stuff, the T1 stuff, and the voicemail stuff. This is the Carfax area now. They're having a few promotions. Here's Randy Summerman's office. This is Randy's camera we're using. He's not here right now. Here's Kathy's office. I think she's at lunch. It's only 2 o'clock. You can see how busy she is, though. Here's the Carfax production area. Hey, Curtis? Yeah. You over there? How'd you guess?
You can tell by the way you were talking.
And hi, do you have a delivery?
Yeah. From Max Print to Brian Schwartz.
Okay. Ann?
Ann's gone.
Oh, who's sitting there? Carla? Carla, can you sign for a delivery, please? Sorry. There's Curtis. Is Mike at lunch? Oh yeah, I forgot. Is Greg here?
Yeah, Greg's back here.
Hey, Greg. Hi, Greg. Greg's on the phone, hopefully making a sale. Ann's at lunch. Oh, there's the delivery guy. There's Curtis cleaning up. What are you doing, Curtis?
What is this for?
Well, this is for UDS, but I think I'm going to send Carfax a copy too.
UDS.
Yeah, LA. Her name is Tehran. Carfax, Curtis, tell us a little bit about your day here at Carfax.
My day?
Yes. How's your day been? Why is it slow?
Because it's Friday.
So Fridays usually aren't busy?
Very slow. Very slow.
Why do you think that is, Curtis?
Because most of the dealers take off Friday, so they can have a 3-day weekend.
As Tehran throws up.
They take Fridays off most of the time. So they can go out and play golf like all
Here
the
is this Greg coming?
Are you taking pictures?
Hey, Greg. Got to clean yourself up a bit there? Greg, how's your day here at Carfax today?
Good.
Are you guys pissed off because you don't get half day off?
Oh, who got the half day off? Mike and Rich. Really? Yeah.
Because they're the winner. They're the team winners, right?
Yeah. That's why Ann isn't here.
Oh,
That's my
Ann
phone,
left
so
early
I
too.
have to go.
Is Michelle here?
No, Michelle disappeared.
Oh.
Oh, that's right. She's at lunch. It's 2 o'clock.
So Curtis is doing some work. Okay, bye Curtis.
Bye.
What'd you say?
I forgot they got this afternoon off. Hey,
Greg.
Greg, I'm bummed about it.
Greg, tell us a little bit about your day here at Carfax today.
Well, I learned that my dental is now 100% covered.
Are you happy about that?
Yes, I think I'll go get my teeth cleaned.
When was the last time you had your teeth cleaned?
Oh, we won't go into that.
Looks like you have clean teeth.
Well, I keep them up, but as far as a professional cleaning, it's been a while.
Well, Curtis has been a while too, huh? Curtis has been like 5 years.
Well, he's longer than me. He's got the record.
But I have nice teeth. I keep mine up.
Yeah, but you need to go get them cleaned.
I know, I will.
Let's look at the mouth. Woo!
It's like,
Randy's camera is an older camera. It doesn't have the capabilities of focusing that close.
Oh, so all you got was a blur.
Yes.
Good.
Bye, guys.
Bye.
We got a cake for UDS production because they've been working really, really hard. Thanks for all your hard work. This is the conference room where we were having the meeting this morning. Do you see the green light? And there's a zoom.
Yep,
in and out.
zooming in on Eric right now. Zach, Eric, it's all your teeth. I got just teeth. That's all I have.
There's me.
There's Tammy.
Hi.
So you got it?
But I'm gonna go up front because Kelly's at
Well, you can
lunch.
sort of sit in between.
I'll run back and
Okay, so
forth.
who you get?
Here's Tom coming to join the party. Any second numbers?
Oh, Chris, did you put your phone on D&D?
No.
Oh, shoot.
I'll get it.
I'll get it.
There's Valerie, scared to death that I'm photographing her.
Oh, Valerie jumped out in front of the camera a few minutes ago.
Here comes the production crew. There's Valerie. Come on in.
Where's Diane? Oh, Kate. Oh, Diane's in here. Great.
We just wanted to thank you all for the hard work this week. It was one of our biggest weeks ever. The other day, we had 60 orders from West Coast, right? Plus whatever Chris and Tom did. And so,
About another 8.
yeah, that's it. It was our second best month so far for the year, 190,000, which is great.
Great
for
job.
being on call. And we
All
just want
right. Woo!
thank you to
Good
Stephen,
job, guys.
Diane, and Mike for all your hard work. We
Good
appreciate it very
job.
much. Sorry David's not here. I think he got
Oh. Have some cake.
Have some cake. Join,
Well,
please.
you go first.
And say a word
I'm
to
sure.
the camera.
I'm sure we could save a piece of cake for David.
This is for the West Coast, so say what you like. This is your chance to tell them what you think.
This is your chance to order.
No more orders. They've become cynical. After the last week, they've become cynical. There's the cake. Oh, what? Oh, looks like just a big white thing.
We have to save a piece of cake for Brian too, don't we? Since he's not here again. Yeah.
It says, if you can't read it, it says, "Thanks for all your hard work." There's Preston. He works for Carfax, and he seldom misses an opportunity.
None of us
There's
do.
Guy Hayes.
I interviewed Guy a little bit earlier.
Excuse me.
Oh, we're gonna send it to LA.
He's been running though. He can have some cake.
That's the top. That's the back and top of Eric's head.
Oh.
We can do the same thing.
Yeah, I know. That's why it's safe to joke about things like that, because I'm losing my hair as well. Anybody else here, and it would have been offensive.
Jeff, did you
Anybody else, and it would have been offensive.
You too?
Yeah, see, right here. But anyway,
There's another call back.
here's Jeff, and that's Curtis giving Jeff the finger behind his back.
Two fingers.
Carfax employees.
Who's cake? This is
Bob,
make some maps for you.
I'm
What is a normal month for you?
Did you order it? Do you have it?
Hi, Chris.
Hi.
by yesterday.
You have a call, you have a call in 00.
I do?
Oh, God,
No, I thought you asked me if I had a few cents there, like, moving everything from the board.
If you don't mind.
What was the total for this one?
I saw you had some.
Oh, and by the way, out in the West Coast,
190 million.
need 40. Oh, ow!
Hey, get out of here.
Black eye.
Reminiscent of this earthquake of Los Angeles. Here, this is what it's like here.
So Chris, what would you like to say to production?
Oh, well, always my heartfelt appreciation
Here's another map.
and thanks. Yeah, and here's another
And
map.
by the way, where's my map?
And by the way, can you redo this site? It's too bad we can't get someone to hold the camera because I'd gladly do Tom's impersonation of a redo request.
I think you got your request.
We'll do that for you.
Oh, there's what? Yeah. This is the newest add-on to the UDS family. John.
Yes, I work it.
He's doing our drive times. He'll be replacing Gary, doing most of the important work.
What?
It's a lovely 100 degrees out.
We had a very good month for UDS in production.
Oh, this is Ken.
Hi.
Sorry.
Hi.
Ken, say hi to the West Coast.
Hi, West Coast. Hi, Tom.
I don't think
Good to see
you haven't met Terry yet, have you? Or
I haven't.
Heaven, or
No, I haven't met any of you out there. I'm looking forward to meeting you. Maybe at the next ICSC convention.
I think we're gonna send
we'll look for some more Hard Rock cafes for you.
You know, there's one on every block.
Like walking around and show the whole office.